with the response to the COVID-19 pandemic in the ESA region. PIA has learned a lot and engaged intensively in the infection prevention control sector with both UNICEF programs and the regional IPC sub-working group. Welcome, Pierre, and over to you.
Thank you, Anna. Thanks so much. I'm just sharing my screen. So as the topic today is about WASH and IPC. So I'm delighted to start with my presentation, and I've seen as well colleagues from other countries are going to present the global perspective, but also some country examples. So I will not have too many examples from countries, and I'm starting now. So let me just move to the good mode and presentation. And I want to remove this, hide the floating, voila, and hide this. Okay. Anna, can you confirm my screen is visible?
Yes, it's great. You can carry on.
Okay. All right. I'm moving now to, sorry, I'm trying to move my slide. Voila. Up. Okay, so I'm going to point as well with the highlighter. Okay, so this is the outline of today's presentation. We look at first this concept of WASH in healthcare facilities and what is it exactly, what are the components quickly. Then we will look, number 2, at what are the benefits of having WASH in healthcare facilities, or what are the consequences when we don't have really good WASH in healthcare facilities. Number 3, we will look at the relationship between IPC and WASH. Number 4, the challenges for building facilities, but also the challenges for getting them functional. Finally, some statistics on the coverage, the situation of the WASH in healthcare facilities, and I have chosen my region, Eastern and Southern Africa, and we will show that there is a need for acceleration. And finally, some solution. In particular, I will not go into too far, but I want just to talk about the WASHFIT. So you all, I mean, health professionals. So here you understand, you can see on the screen the key components of WASH in healthcare facilities. It's a package that is absolutely essential to have as a whole. Okay, if one component is missing, we cannot say we have a good coverage in WASH in healthcare facilities. It's a partial coverage. To have a whole coverage, it's you should have obviously the water supply for cleaning, for washing, and another one is with quality water for drinking. It's not the same water. Sometimes water for cleaning is can be non-potable, but water for drinking obviously is. In all sections of the healthcare facilities, the staff, but also the patients and co-patients should be able to clean hands with soap, to access sanitation services, and also to be prevented to access waste, in particular the dangerous waste that is called the hazardous waste. But all waste in the healthcare facility can be dangerous. Finally, what is not really visible unless it is not done is the cleanliness. And you have staff that are in charge of cleanliness, of waste management, and operations of the water and the sanitation. At the bottom, the overarching and the the foundation is ready to have a good services and staff and management for the WASH in healthcare facilities. So here are some common issues found in healthcare facilities in my region, in Eastern Africa. So obviously, it's when there is no hand washing station, or sometimes there is hand washing station functional only for the staff, not for the clients, for the visitors and the patients. The second one is when, for example, the hazardous waste are not well managed, and anyone is exposed, in particular children are exposed to waste. This one is when you have toilets, but it's not functional, or sometimes there is no toilet and there is open defecation. So I'd like to hear from participants in the chat box, please, if you have other issues you would like to mention on observed issues related to WASH in healthcare facilities. Write it in the chat box, please. Now, I selected a few and the main consequences for limited or absence of WASH in healthcare facilities. The most serious one is this one. It's we have a risk of transmission of infections that can basically, they are called, as you know, the nosocomial diseases or the hospital acquired infections. The most at risk are the staff, but also the patients and co-patients. The figures for this will be certainly given by my colleagues, but the figures in Africa, it's not well known, but they estimate is at least the double than the nosocomial disease in Western countries. That is estimated, if I remember well, to 10 to 15%. That means one person out of 10 can have a disease, nosocomial disease. So that's certainly in the order of 20% for our region. Then we have to think of the dignity of the staff, the dignity of the patients and co-patients that is affected when they have to go for open defecation. It has, of course, a direct impact on the staff morale and can have implications for absenteeism. Also, in terms of communities, you may observe a decline on health-seeking behaviors and a lack of trust in health systems. Consequently, there is also risk for untreated health conditions if people do not go to the facility because to the health facility because it's not clean or there is no water. Now looking more carefully on IPC, infection prevention and control, and how are IPC and WASH interlinked. Okay, as you can imagine, they are highly interlinked, because if you have no WASH, there is no IPC feasible in the healthcare facilities. So I tried here to map on this graph, that is not a graph, that is more a diagram or figure, the different component of healthcare facilities, the different components of IPC in healthcare facilities. So you can see here that on the left side, all these components that are considered as WASH in healthcare facilities are actually, there also are IPC measures. Okay, hand hygiene, water and waste management, cleaning, disinfections and sterilizations of medical devices, environmental cleaning, disinfection of the walls, of the floors, of the handles, And then these three components I put together, but there are three different ones: access to safe sanitation, drainage of the facility, and vector control in the facility. All these are considered as WASH, but also IPC. On the right side, it's more clinical IPC, I would say. Although this one, sterilizations of medical devices, is clinical IPC as well. Finally, in the middle, we need capacity development. We need the monitoring systems, and we need the good management of the healthcare facility to have a good and integrated IPC and WASH services. And certainly the one we tend to neglect is how to enhance the behavior for applications of protocols. This is very difficult, and this is where we need a specialist in social and behavior change, not only for the healthcare workers, but also for the trainers, how to train with an impact on behavior change. Talking about the, for example, the coach, the IPC coach, the environmental health specialist, the inspectors, etc., the people that are working for enhancing the IPC and the IPC focal point skills. Okay, so the challenges are big, and we'll see later the coverage is also low in some conditions. So we have two types of challenges. One is at the time of building and installing the facilities. Okay, this is about investment, this is about constructions, this is at the early stage. But when the facilities are here, it's to keeping them functional, to keeping them to have a good preventive maintenance, a good operation, and repairs when it's needed. So here I selected a few imperatives, a few important things for addressing these challenges. Of course, the national standards. Generally, we have in the region very good standards, but the problem is to implement the standards. It's quite you need a capital investments in healthcare facilities that is sometimes and often insufficient. So it's about budgeting for healthcare facilities with the WASH component. And also, I would say, because it's not only, it's really, when we talk about water, it's really connecting the water system to the utility or to the healthcare facilities. So it's not about MOH, it's not only MOH, it's really Ministry of Water or the local water utility or the local council that should invest as well in WASH in healthcare facilities. During the construction, there is sometimes a quality assurance problems that result in bad quality of the facilities, of the toilets, of the water systems. Consequently, you can have early damages and frequent problems, I cannot say the word, but it's when frequent drop down of water. Sometimes it's also when it's built, they are not really fit for purpose. They were not badly designed, and also they do not respect the national standards. As I said, the really important thing, the challenge is to have the protocols and staff trained for preventive maintenance. The importance as well of conducting IPC and WASH assessments with improvement plans, and to get the plans funded as well. Okay, now we have as well the problem of the consumables. The problem of the consumables like the cleaning products, the chlorine, but also the equipment that needs to be replaced. The staff as well, you know, in healthcare facilities, with the cleaning staff is sometimes not really well appreciated, or when they appreciate, it's not. Yes. Okay, and then as I said, another one is about behavior change that can be insufficient, but undermine the skills and disrupt the services. Okay, here I have some statistics. I will not go into the details. So this is from the washdata.org. This is the WHO UNICEF joint monitoring program, and with the component on healthcare facilities. And also on the right side, you see the WASH in healthcare facilities coping study done by UNICEF in 2019. So looking at the water now, the water supply, as you can see, the coverage, the problem we have in rural areas is immense. We have more than half of the healthcare facilities do not have basic water. They have limited access or no water at all. When we say limited, that means it's not connected to a continuous system water supply. It can be discontinuous, or it can be with water trucking. As you see, also the government institutions have a lower basic access than the private institutions. Now looking at the sanitation, again, here we have a very serious problem in rural areas. Okay, we have less than 5% that would say they meet the minimum standards for WASH, for sanitation. Sorry. When we look at the limited access here, it means that there is access, but it's sometimes it's dirty, or there is not segregated toilets for male, female, etc. So, and we have a significant number as well, almost 25% of facilities where there is no access to toilets. We don't have a lot of data on the service levels for WASH, but again, if service level is really about looking at the water sanitation and hygiene, but you can see that almost 3/4 has no level at all, no service, or very low service level, or limited. For waste management, again, there is also a problem of we have a rural-urban disparities with about one third of facilities in rural areas meet the criteria for waste management. That means in 2/3 of the healthcare facilities, I repeat, in 2/3 of the healthcare facilities, there is risks of infection transmissions to poor waste management. Again, here we lack data for, this is about the cleaning and disinfecting. But again, in 2/3 of the healthcare facility, the cleaning and the disinfecting of surfaces, of floor, do not meet the basic standards with consequent risks of disease transmission. So we talked about the strong link between IPC and WASH, and I want just to finish with this one of the solutions to improve WASH and IPC in healthcare facilities is to use what we call the water and sanitation facility improvement tool. Okay, this is a tool developed by UNICEF and WHO, implemented in many countries in our region. We counted it's on at least 11 countries in ISA region. It's a tool for assessing the risks and promoting the improvements. Okay, of the WASH and IPC in healthcare facilities. So WASHFIT is not a one-time operation or intervention. It's a process. It's a process that continue years after years, and the objective is to address the risks and to cost the improvements, and also to use it for advocacy, internal advocacy at MOH level, but also advocacy for international donors to improve the funding for WASH and IPC in healthcare facilities. Obviously, it's guided by the WHO standards for healthcare facilities, and it's aligned with the sustainable goals for 2030. Then I gave this an example as well for development of MOH or agency staff. It's to participate to different courses on WASH and healthcare facilities. One is proposed by UNICEF and the Emory universities. It's called the WASH in healthcare facilities distance learning courses, and it's available once a year through UNICEF website. How does WASHFIT, so the tool and the process is integrated into the healthcare facility 8 practical steps from WHO. So here I proposed the 8 practical steps adapted to the I mean at healthcare facility level. It's not the one at country level. It's down to the healthcare facility level. So what's important, obviously, is to start with a situation analysis and an assessment, technical assessment, that includes both WASH and healthcare facility. So for it, the WASHFIT is an excellent tool. But for the IPC, it can be complemented with other tools you have certainly learned in this course. And so WASHFIT is really focusing on non-clinical IPC and WASH. Okay. Once the assessment is conducted, the next phase is basically to look at where the situation today with the healthcare facility directors, the staff, the IPC focal points, to set some achievable targets for gradual improvements, okay, month after month, and to set a roadmap that is achievable. And including one is about being sure that all staff are aware of the standards operational procedures, right, and protocols. Okay. And this can be done gradually as well at different for different staff categories of staff, but it's absolutely necessary. The protocols and the procedures are known and visible in the healthcare facilities, and also the measures are put in place for implementing these protocols in a systematical manner. This obviously, when there is problem of hardware, you may have external interventions to maintain, to repair, or to install the hardware. The wash hardware, meaning the water supply, the sanitation, etc. Monitoring system as well, WASHFIT can help in it. This is about developing the healthcare healthcare workers workforce. It's a little bit connected to this one. It's a little bit about skills development, behavior change. In rural community, it's sometimes important to engage the communities as well for participation. Could be financial participation. It could be as well supporting, for example, the staff, the cost of the staff that are not in the staff, in the staff covered by the Ministry of Health, to pay, for example, for the cleaners or the guards. And then at facility level, sometimes it's important to stop and to conduct lessons learned on the process. What have worked, what has not worked, and what can be the corrective actions, the corrective course of actions before the next cycle of the WASHFIT. So I presented only one tool, but there are many other tools that can be used for integrating WASH and IPC in healthcare facilities. And I'm available for questions or if there is any development needed.
Thank you very much. Thank you very much, Pierre, and thank you for this informative information. And I'm sure if you can look, there's quite a few questions on the Q&A box. I'm going to take us to the next presenter, and that is Mr. Nquan Jacob Gopta. He's an IPC WASH nurse for many years at the Cameroon Baptist Convention Health Services. Jacob is also an ICANN board member and just newly elected secretary of ICANN. Jacob has been very active in getting IPC and WASH connected and making sure about having IPC in Cameroon, working with the Ministry of Health and with his organization as well. Jacob, I'm going to hand over to you to just say hi to everybody, and then we can take it from there. We can see your slides. If you can just move it up to the first one and then put it into slide mode. Thank you.
Thank you, Anna. Good morning, good afternoon, good evening to everyone. It's a pleasure for me to have this opportunity to share with you. I hope you can hear me.
Yes, we can hear you, Jacob.
Okay.
But I think for bandwidth, you can switch off your video if you want to. It might be better.
Exactly. That's just what I wanted to do.
Okay.
Where is it? Good. Yes. Thank you. I will be talking on the topic, the place of infection prevention and control, and then WASH in primary healthcare. And I will be talking from an advocacy point of view. I want to thank Pierre for laying a very solid foundation for my discussion. On the 22nd of March, we celebrated the World Water Day on the topic groundwater, making the invisible visible. I hope that you all commemorated the day in your different organizations and facilities. I am highlighting this because without water, every other thing about IPC WASH is actually challenged. And I think that this is a very important prerequisite for us to ensure that we have effective IPC practices in our facilities. As Pierre mentioned, even up to date, open defecation is still being practiced in many communities and countries around the world. And
sorry, Jacob.
Yes,
Jacob,
Anna.
sorry, can you just put your presentation in slide mode? It's still not in slide mode, please.
It is on my side, it is on the slide mode. I don't know why it's different from your own side.
We can see both your the slides and the other one, so I'm not sure. But carry on, please, that's fine. Just
okay. So the last statement I made was that open defecation is still being practiced in many countries as well as communities around the world. And then up to 2020, according to the data, 55 countries are still practicing open defecation. And in those countries, we'll have about 5% of the population. Even though the situation might be different in different areas. For example, in Cameroon, we have about 13% of the population practicing open defecation, and the majority of them are coming from about 3 regions. IPC is actually defined as a scientific approach and a practical solution designed to prevent harm caused by infection to patients as well as health workers. And it serves as an essential function in infectious disease and global health. And effective IPC is a public health matter, and it is very fundamental for patient safety as well as health system strengthening. The prevention of healthcare-associated infections, including Ebola and many other infections, is an example of an intervention that you can use in order to prevent infection in the health facilities. And in fact, within 2020 up to date, we have really observed the value of IPC in preventing the COVID-19 infections. And therefore, if IPC is not rooted in all practices in our health facilities, then the risk of healthcare-associated infections is actually going to increase within the health facilities and even in the communities. And therefore, we can look at IPC as a strategy which is designed to minimize the risk of avoidable healthcare-associated infections amongst patients as well as healthcare workers. Infection prevention and control are essential for community health, and it can be used to limit healthcare-acquired infections as well as the general spread of epidemics and pandemics. Of course, many years ago, we were talking of Ebola, and the last 2 years, we have been in a very big epidemic, the COVID-19 epidemic. And we have also understood that if IPC is effectively practiced, then all of these epidemics, we are going to limit the spread. And therefore, we can say that the foundation of IPC actually is hand hygiene.
Sorry, Jacob. Your slide is not moving on. Do you want to maybe stop sharing and let me share from my side, and then let me see if that will work?
That would be better, Anna. They are moving from my side here. I'm surprised that they are not moving from your own side. Maybe you can share.
Yeah, even the others are also saying that they can't see. So let me just try and share from my side, and then you can just tell me where to go. Okay.
Okay. Thank you. You can go ahead and share.
Okay. So let me just take it to slideshow.
That's good.
And which one? You must just tell me on which slide you were.
Yeah, continue moving. I will signal you to stop. Continue, Anna.
Okay, let me just, sorry, I just have to redo that because, okay, so you can see slideshow.
You will move to slide 10.
Okay, let me move to slide 10.
Yeah. Good. Okay, next slide.
Do you see my slide?
Yes,
okay.
I can see. Okay,
All
next
right.
slide, Anna.
Okay, is it moving?
I can't see it. It hasn't moved yet.
Okay, just.
Good.
There you go. Okay.
Move to slide 11 now.
Okay.
Yes. Are we there?
Yes.
Move again. Okay, just one slide behind. Next slide, next one in front, just move one by one slide. Oh, good, thank you. So what I was actually saying is that, are we there? No. Can you move behind a little bit, Anna?
That one, Jacob?
There is a problem. They are not moving accordingly. Maybe.
Okay, which are you on water sanitation hygiene 2.4 or 2.3?
It's supposed to be IPC, not yet on this one yet. Let me just open it and then maybe I can present from the slide here and then I will call the slide and you move as I move from here.
Okay.
Yes. So I am on slide 8 now. So I was saying that IPC is the foundation of, it is a strategy to prevent healthcare associated infections within the health facility. And I said hand hygiene is the foundation of IPC. So now let us look at water, sanitation, and hygiene, WASH. WASH simply means water, sanitation, and hygiene. And safe drinking water, sanitation, and hygiene are crucial to human health and well-being. Now, Pierre already illustrated the relationship between WASH and IPC. And if I have to use the ICT language, I would say that WASH is the hardware and then IPC is the software, which means IPC is the application. And if there is no WASH, then it means you will not be able to practice IPC. For example, if you don't have water in a health facility, then there is no way you can be able to wash hands. So self-wash is not only a prerequisite to health, but it contributes to livelihood. It also contributes to school attendance, and it contributes to dignity, and it helps to create a resilient community in our health facilities. Slide number 9. According to the UNICEF, every child who is growing up in a clean and a safe environment is a right. So it is a right for every child to grow in a clean and a safe environment. And access to clean water, basic toilets, and good hygiene practices do not only keep children growing up, but it also gives them the healthier start in life. Of course, where there is no clean water, the children are going to be affected first because they will not be able to grow, and then they will not be able to attend school whenever they are ill. And then the expenditure of the family is also going to increase. Therefore, WASH is fundamental to child survival. It is fundamental to child education. And then it is also fundamental to universal health coverage. as well as Sustainable Development Goal. Now, when children do not have access to clean water, it affects their health, it affects their nutrition, it affects their education, it affects their learning abilities, and thus it impacts many aspects of their life. Slide number 10. WASH is crucial for prevention of healthcare-associated infection, as I already mentioned earlier, and it is supposed to be rooted in IPC measures. A guiding principle on WHO core components of IPC is that access to healthcare services designed and managed to minimize the risk of avoidable healthcare-associated infection for patients as well as healthcare workers is a basic human right. Now, when we look at IPC WASH as a human right, therefore, it's not something that we would debate whether it should be available or not. It's something we just have to do it, and it's something we must do it. Now, WASH in healthcare facility help to reduce the risk as well as the risk of infections, as well as improve infection prevention. And it is very crucial for control of outbreak like cholera. Presently, we have an outbreak of cholera in Cameroon, and it may be also present in many other countries. We can also use WASH to control the outbreak of COVID-19 as well as other infectious diseases. Therefore, without WASH, without sanitation, without water, without hygiene services, mothers and newborn may not receive quality health care that they need. When health facilities are equipped with safe WASH, then members of the community are more likely to visit them, and health workers are able to model good sanitation and hygiene practices. Now, if you take a health facility that does not have a toilet, just imagine conducting a delivery in a delivery room that does not have water, for example, and then a maternity that does not have a toilet. Then you can imagine how uncomfortable it can be to women as well as the healthcare workers. Slide number 12. There is a statement here that I found in Zambian IPC guidelines, which I think is very, very important to highlight here. It is said that primary healthcare facilities and hospitals are the first point of care for sick and vulnerable population, and are therefore crucial to responding to public health emergencies as well as outbreaks. In a good healthcare system, for example, the primary healthcare facilities are supposed to respond to at least 80% of the healthcare needs of that community, meaning that if you strengthen primary healthcare services, then you are going to impact the life of many people in that population. And then it was also mentioned that a lack of appropriate WASH services increases the exposure of infection to patients as well as healthcare workers. How I wish all the countries in Africa, in the world, and all over should have this mindset that Zambia has. And I believe there are many countries that are already taking steps to improve IPC WASH in the healthcare facilities. Now, despite the fact that WASH has been an old concept, we still have a lot of gaps that exist. I am not going to be listing them one after another, but we need to note that if we do not have adequate WASH, then all the sustainable development goals are not going to be met by 2030. And then we will still have children die of diarrhea diseases. We will still have people who will be drinking contaminated water. And then we will still have a population, maybe 50% of the population of the world, that will not be able to practice a safe defecation. According to the recent data that was published by WHO and UNICEF in 2021, it is indicated that 494 million people still practice open defecation, and about 1 in 3 of the global population, that is 2.3 billion people, lack basic hand washing facilities at home. And then in 2020, only about 1 in 4 people lack safely managed drinking water in their homes. meaning that only about three people have, 3 out of 4 people have safe drinking water at home. Now, there is a survey that we conducted in Cameroon in 2020, in which we surveyed 103 facilities. We grouped them into 3 groups, that is hospitals, integrated health centers, and then the primary healthcare facilities. And then the hospitals, they represent the blue bars, and then the integrated health centers, they represent the deep blue bars, and then the PACs, they represent the green bars. Now, if you look across, you will discover that the least coverage, wash coverage, is in PACs. For example, for cleaning, only 23% of the facilities had adequate wash. For hand hygiene, 31%. Then for healthcare waste, 15%. Sanitation, 7%. Water, 26%. Management, 2.9%. And then hand hygiene framework, only about 22% of them had adequate hand hygiene infrastructure, compared to hospitals and integrated health centers. Now the question is, why is wash coverage the lowest in PACs? Now, still in this same survey, these are some of the toilets that we found in some of the facilities. Toilets that did not meet IPC wash standards. For example, if you look at these toilets, some of them are very fragile and they can collapse at any time. And then there are toilets that cannot also be cleaned. They are not enclosed, and then they are not separated according to gender and according to staff and patient. Slide number 17. Now, still in another survey that we did in 2021, in 71 facilities, we discovered that only 25 facilities did not have water. At all, they did not have water at all. And out of those 25 facilities, 22 were primary health centers. Now, if a health facility does not have water, can you call it a health facility? The answer is no. Now, the question we are asking ourselves, why has wash coverage remained very low for a very long time, over 40 years period, since we adopted the primary healthcare concept? And what are the consequences of the low wash coverage in our health facilities? Of course, these are just my impressions. I think that the cause of poor wash coverage in our facilities is due to limited funding. If you look at the health budget, according to Abuja Convention, where it was agreed that health funding should be at least 15% of the national state budget, up to date, less than 30% of the countries are able to meet that requirement. Then the second problem that I also think is the cause is inappropriate distribution of resources. In many countries, most of the health resources are focused more on urban facilities than rural facilities. In a certain study that was conducted in Cameroon in 2010, it was discovered that 40% of the health resources were found in 2 towns, which is Yaoundé and Douala, which cover only about 18% of the population. Then the third problem, the third cause, is lack of political will. If the leaders who control the resources, if they did not buy into WASH and IPC, then they are not going to make sure that the WASH and IPC are given adequate attention. Slide number 20. What are the consequences of poor WASH? Of course, as I mentioned earlier, if we did not focus on WASH, it means that most of the sustainable development goals will not be able to be met. we will not be able to meet universal health coverage and many other health indicators. And the most serious thing is that women and children will be seriously affected because they will be the first people to suffer. And then there will be increased burden of healthcare associated infections. And once the healthcare associated infection increase, they will also drive up antimicrobial resistance. And then there will be maternal and neonatal mortalities. Outbreaks are going to increase. And once we spend more on diseases and outbreaks, then the poverty level is going to increase. Slide number 21. Consequences continue. We will see that only 81% of the world population will have access to safe drinking water, meaning that 29% will suffer and maybe die. Then 78% of the population will have access to basic hand washing facilities by the year 2030, meaning that about 22% of the population will not be able to wash their hands adequately. And if all of these are not done, then you can imagine the consequences that will follow. So, what is the place of IPC WASH in the PACs? The first thing is that the provision of safe water, sanitation, and waste management, as well as hygienic conditions, is essential for preventing and protecting human health during all infectious disease outbreaks. Now, what we are currently doing is reactive IPC, meaning that we wait for an outbreak to occur, and then we will maybe mobilize resources and then step off IPC. And then when the outbreak subsides, and then we go back to the old practice. But the most important thing we need to note here is that IPC is not only meant for outbreaks, it is meant for preventing outbreak, which means we need to actively engage in proactive IPC, meaning that we need to strengthen IPC even before an outbreak occurs. We need IPC to prevent outbreaks. We need IPC when outbreaks occur. We need IPC at all times. Therefore, we need to focus our effort on strengthening IPC in our health facilities and especially our primary healthcare facilities. Now, the next thing is that ensuring evidence-based and consistently applied IPC as well as waste management practices in communities, homes, schools, and all gatherings will help to prevent human-to-human transmission of pathogens when an outbreak occurs. I think I don't need to overemphasize this because with COVID-19, we have seen that at all levels, if we improve IPC, then we are going to prevent the transmission of infections or pathogens whenever there is an outbreak. There are multiple benefits of IPC, which I'm not going to highlight for the purpose, the issue of time, but you need to know that when you have IPC, it will increase staff performance and staff morale. It will also improve the dignity that you will give to your patients, and many people would like to visit your health facilities. We will prevent outbreaks, we will reduce costs of healthcare, and so on and so forth. Now, to conclude, what I've been trying to say is that we need IPC to achieve multiple health interventions. For example, universal health coverage, sustainable development goals related to health, and then WASH. Unfortunately, WASH has not been given proper attention in many countries. There is a need for us to improve WASH, both at the national level as well as the facility levels. There can be no quality care without IPC WASH. IPC WASH is the foundation of quality care. And therefore, if we want quality care, therefore we have to focus on improving the IPC WASH in our facilities. There is a need to integrate IPC WASH into primary health care so that we can be able to strengthen IPC WASH in the different facilities. Then there is also a need to use WASH as a strategy to promote primary health care as well as universal health coverage. Now, what do I mean here? What I mean here is that any funding, any strategy that is aimed at promoting primary health care or universal healthcare or sustainable development goals should begin with IPC Wash. And therefore, the funding organization should be able to prioritize projects that contain IPC Wash as a component. And therefore, there is need to increase funding for PACs as well as strengthen IPC Wash at the level of the PACs. At all levels, including the national, global, and the facility level, we need to ensure that we specifically designate some funds that will go to improve wash and make sure that every facility has water, every facility has decent toilet, and every facility has waste management infrastructure. Without all of this, then any other thing that we try to do is going to be difficult. So there is no way we can practice IPC if we do not have wash. And if we do not focus on wash, then we will continue to respond to outbreaks. We will spend all the money on responding to outbreaks, and then the population will continue to suffer year in and year out. We need wash to prevent outbreaks. We need wash when there is an outbreak. We need wash at all times. Thank you.
Thank you very much, Jacob. Thank you, everybody, and we're sorry for the few glitches. I'm quickly going to play the video just to give our interpreters a chance to raise their voices, and then we will straight move over to Dr. Radebe. So if you can just bear with me, I'm just quickly going to share with you the video. It's a very short video, it's not even 2 minutes long. So let's start the video.
Let's say with health issues, only critical patients are being admitted to Temba Hospital at Kabokweni near White River in Mpumalanga. This because of a damaged water plant which is affecting water supply.
A desperate time for patients and staff at this hospital. Taps have been dry for some time now. The theatre is not operational because there's no water.
Our operation systems again are not working. Patients are not being admitted as they're supposed to be. All other work like your operations cannot be conducted because of the problem of water. So we are very, very frustrated.
Water tankers are being dispatched to the hospital, but the demand remains high.
We are
Sorry,
trying
Anna,
to,
we are not seeing the video.
solve the problem.
Okay,
And
sorry, let me just quickly
during
stop me. Okay, sorry for that. I think it's because I'm using more than one screen, so let me just remove the one screen.
Let's say with health issues, only critical patients are being admitted to Temba. With health issues, only
Can you hear it now and see it?
Yes, it's fine.
Okay.
critical patients are being admitted to Temba Hospital at Kabokweni near White River in Mpumalanga. This because of a damaged water plant which is affecting water supply.
A desperate time for patients and staff at this hospital. Taps have been dry for some time now. The theatre is not operational because there's no water.
Our operation systems again are not working. Patients are not being admitted as they're supposed to be. All other work like your operations cannot be conducted because of the problem of water. So we are very, very frustrated.
Water tankers are being dispatched to the hospital, but the demand remains high.
We are trying to solve the problem, and during, as I speak now, we are meeting almost every day to come up with a plan. How are we going to do it in the long term?
Frustration is mounting on those affected.
Will be affected serious. Some of the diseases are coming from not washing. We need to wash hands, we need to clean our hands, brush our teeth so that we can smile properly.
Actually, I was paying my friend a visit. The way it is, it's not good because he's not even washed himself because there's no water, and water is the basic thing that we need. So it's very terrible.
The Department of Health says there's nothing much it can do about the current situation. They'll continue to scale down on the admission of patients until the water problem is resolved. Mweli Maslela, SAPC News, at the Temba Hospital in Mpumalanga.
Thank you very much, everybody. I'm going to move straight over to our next speaker. And that has been very waiting for us. So Dr. Radenta Bagekwa. She's a microbiologist that graduated from the University of Health and Allied Services in Tanzania, and she's done a dissertation. Sorry, Radenta, there's some feedback on your side. She's also joined the Ministry of Health. You can start. So over to her.
Thank you, Annie. Good morning and good afternoon, everybody. As I have introduced, I'm Radenta Bahegwa from
Sorry, Radenta, there's some issues on your sound. That sounds better. There's a feedback that's coming through.
Okay. So, do you hear me now?
Maybe just switch off your video. We can hear you. Just switch off your video. Let's see if that will help.
Okay.
Okay, and then just put your video, your presentation in slide mode.
Do you hear the
Yes.
slide? So, you're welcome to hear the experience from Tanzania on WASH as a critical component for IPC. And these are my outline of presentation. We're going to hear the overview of WASH in Tanzania and national level action on WASH, key achievements on WASH, key challenges, and the way forward to improve WASH. First of all, this WASH is sustainable development goal number 6. We have to ensure availability and sustainable management of water and sanitation.
I'm sorry, Radenta. Sorry, your voice is coming and going. If you can just check your microphone, it seems like you know, your voice, we hear you and then we don't hear you. Just double check on your sound that we can just hear you better. Okay, just go ahead, let me just find out.
Do you hear me?
I can hear you now better, yes.
So an overview, improve WASH. This is very important because it is essential for protection of human health against infectious diseases and outbreaks. Also, WASH is necessary for resilience against infections between community and healthcare facilities. And also in WASH, we need healthcare waste management, which is improved as it is one of the components of standard precaution. And also through improved WASH, it will contribute to reduction of antimicrobial resistance as is pandemic now. So we need it in order to prevent the problem of antimicrobial resistance. And poor WASH services contributed to healthcare-associated infection, as globally it caused 53% of all neonatal deaths in developing countries. This is due to poor WASH. And from the UNICEF 2015 survey, it shows that 80% of facilities in developing countries had no basic discourage women from giving birth to healthcare facilities and seeking care. So it contributes to neonatal death and maternal morbidity. From systematic reviews, it shows that 58% of all the study reviews show that improved wash in health facilities contributed to decrease in multi-drug resistance organism colonization or healthcare associated infections. Also, basic hygiene practices contribute to reduction risk of infections, sepsis, and death for infants and mothers by over 15%. So WASH is essential condition for effective infection prevention control in healthcare facilities. From the results of survey conducted in Tanzania in 2015, it shows that 60% of facilities without regular performing without regular water supply, and 10% of hospital latrines are not improved. Also, we had a problem of 25% facilities with no hand hygiene facilities at point of care. In the last three, we found that 67% of surfaces in healthcare facilities are colonized, as you see in this picture at this slide. Also, come to the national action which has been taken after finding the results from the baseline on WASH in our country. First of all, the country at the national level, we developed the WASH guidance in healthcare facilities in October 2017. This is a picture of the guidance, and it is available on our website, Ministry of Health. This guidance discusses the requirements for each level of these facilities in terms of water quantity and quality, availability of toilets and the hygiene facilities, the requirements for each level. Also, this guideline has identified the stakeholder mobilization in order to improve WASH services in our country. We have also the national policy guidance for healthcare waste management. This was developed in 2017. We developed also national catalog for healthcare waste equipment, supplies, treatment, and disposal methods in 2018. Also, we developed a national strategy for accelerating sanitation and hygiene for all. And this is from 2020 to 2025. And the last one, we developed the environmental cleaning in healthcare facilities guidance, and this is in draft. But also we have infection prevention control guidance, which is aligned with all WASH documents in order to have one thing to strengthen WASH in order to improve IPC practices in our facility. So those are national action levels. So from there, development of guidelines to facilities. Also, we as a government, we have the program, which is known as Sustainable Rural Water Supply and Sanitation Program. This program was initiated by Ministry of Health in collaboration with the World Bank. And from this project, 85% of resources are used for rural water supply and sanitation in order to improve WASH in these facilities, especially in rural areas where we had much progress. We have another program which is called WaterRate. This is also a project which was launched in order to have effective and efficient WASH services in Tanzania. We have another project known as MUKAJ, which is extending for water for public health, and it was launched the WASH program, and it is targeting for 90 healthcare facilities. And these are the pictures which show the improvement of WASH services on the projects which have been mentioned in previous slides. In this region, in Kagera region, we have the improved the toilets, as you see, toilet block for plants. We have water tanks, which are temporarily storage, and then we have also hand washing facilities at the point of care. So these are the results of the project, which were aiming to improve wash services at rural areas. And this is another pictures which are showing the improved wash water quantity, hand hygiene, and sanitation, including toilets. Come to the achievements on WASH at health facilities in here. Through sustainable projects, infrastructure have been installed in 12 health facilities, which including boreholes, rainwater harvesting system, and a solar panel. And this was through WaterRed in Tanzania. Another achievement, we have seen maternal and newborn experience improved. Now maternal women are coming to the hospitals and the other health facilities to experience and getting health services, and this have been reduced neonatal death and the maternal death. But also through the project of 1900 community health workers have been trained, and they are going to the community to sensitize community members, first of all, to access the healthcare services, and also to have them improve the wash at their household. Also, communities are now effectively sensitized and engaged to improve washing services. Another achievement through the project for sustainable rural water supply and sanitation. Through this project, 874 healthcare facilities have gained improved washing facilities, and their labor rooms are now provided with the showers and toilets, have been repaired, floor holes, adequate lighting, and washing points with water and soap. Also, we have seen construction. We are continuing with construction and rehabilitation of 662 healthcare facilities in this project. And also, there is another community awareness campaign, which was phase 1. The campaign is called Nyumbani in Swahili language, but in English it means that you can't call a house with no toilet. So this campaign was initiated in 2017 to 2021, and it was using the influential people, including artists and religious leaders and traditional leaders. And this campaign has helped us much to raise the awareness to community the importance of having toilets in the And through this campaign, the houses which have in toilets have the magnitude have increased from 37.1% to 72.2% in 2021. And the proportion of people open defecation of non-toilets have reduced from 5.7 to 1.4% in 2021. These are the achievements which have got to project. So we have, despite of having those achievements, we have challenges, and challenges are, first of all, we still have inadequate standardized hand hygiene We still have shortage of water testing kits for water quality monitoring. Current in rural councils, only 4% of councils have appropriate kits. And also we have inadequate toilets in number of population except in many healthcare facilities. So our way forward now is to continue with the resource mobilization for WASH services by sensitizing different stakeholders, and this will contribute to improve the WASH. Another way forward now, we still are building capacity to councils to monitor WASH services, including water quality in healthcare facilities. The next plan in this year we launch again the second phase of this campaign, community awareness campaign, to raise awareness and the importance of having toilets in their houses. Last year we have plan to continue to sensitize healthcare facilities in the community on COVID-19 prevention, which is aligned with improving WASH services. We appreciate our government. There is a political will, and talent to WASH is a standalone pillar in fighting outbreaks, and through this WASH as a standalone pillar, it has a lot of plans, and this was in order to improve WASH services. As we know, as we improve WASH service, IPC will be at required requirements. Thank you. Over to you, Anna.
Thank you very much, Radenta. There was some glitches in your sound, so a lot of people couldn't hear properly. We're not sure what was the problem, but we will share the presentation with them, and we want to say thank you. I'm going to hand over. I just want to find out, Dr. Ario, do you want to handle the question or answer, or do you want me to ask Lizzie to take that forward? We've got a few minutes left.
Yeah, please go ahead, Anna. Thank you.
Okay, thank you, Ario. Lizzie, can you just take us through? I think there's one or two questions, and there was one question on the chat as well. You can stop sharing now, Radenta, please. Thank you.
Thank you, Anna. Good morning, good afternoon, good evening from wherever you're joining us. And welcome to our question and answer segment. First and foremost, I'd like to thank our interpreters and the presenters for such informative presentations, and also to Cameroon and Tanzania for giving us a peek of what is happening in their respective countries. And looking at the time and the fact that most of the questions have been asked, I would just kindly just ask the presenters, starting with Pierre, then followed by Dr. Radenta, and lastly by Jacob, just to give a summary and encouragement of what infection control practitioners and WASH practitioners can get to do in terms of collaborating the WASH and IPC systems in place, and ensuring that they create a healthy environment, both in the healthcare facility and in the community. Over to you, Dr. Pierre. Dr. Perry, are you still on the call? Or if not, I can direct that to Radenta, Dr. Radenta, if just the parting words and summary of encouragement to the healthcare practitioners that are on the call. Over to you, Dr. Radenta.
Thank you. Do you hear me?
We can barely hear you.
Hello, can you hear me?
Yes, kindly go ahead.
Okay, thank you. What I can say in summary, infection prevention control practitioner and WASH practitioner can continue collaborate with each other in terms of sharing their plans, because you can't do only IPC, and you can't only improve WASH without having IPC. So first of all, they should cooperate and their plans and to mobilize the resources, because if you want to improve WASH, you need the resources. So the collaboration in plans, in developing strategic plans, and the mobilize resource will be the first option to have improved the WASH services, and this will contribute to improve the IPC. So this I see is very important. And first of all, they have to, everyone should do the need assessment and to know where you are and what are the gaps in order to prepare that strategic plan, and to know where you have to start in order to improve WASH and to improve IPC in general. And at community level, we don't have any reason to escape. We should sensitize communities because and the good thing when community is sensitized and they know the importance of having good and improved WASH, they will try and make sure they have improved WASH. So we have an urge to continue to sensitize communities. Thank you. Over to you.
Thank you, Dr. Adenta, for those wise words and encouragements and how we can get to implement WASH in healthcare facilities, and also the critical role in which WASH plays in terms of also IPC, and the need on why the IPC and the WASH have to collaborate the activities. I'll hand over to Jacob also to share his thoughts, and then we can hand back to Anna. Over to you, Jacob.
Thank you, Lizzie. In the past, there was really no clear definition about how WASH and IPC relate. And in the same facility, you will have IPC people on their side, then WASH people on the other side, and no one communicates with the other. And beginning from a few years ago, that discussion has become very loud and clear. And the relationship between WASH and IPC is that of the computer hardware to an application, meaning that the computer cannot function without the application, and the application cannot function without the computer. Therefore, we all need each other. And if we communicate well, we collaborate well, then we are going to impact each other. So from now henceforth, we should take note that WASH is the hardware, then IPC is the software, and the hardware needs the software, and then the software also needs the hardware. So there is no gaps. If there are gaps that exist, those are human gaps, which if we want to be successful, we should try to minimize them as much as possible so that we can be able to function effectively. Then an IPC person should function with a WASH mindset, and then the WASH person should function with an IPC mindset. In that case, we'll be able to see the value of working together. Thank you.
Thank you so much, Jacob, for that. And I would like to hand over to Anna for the closing remarks.
Thank you very much, Lizzie. And I want to just really thank the panelists. I saw there was quite a few people from Africa CDC, SILAS, that also joined us, Dr. Ario. I saw Sabila, all the panelists, Jacob, Radenta, Pierre that had to unfortunately leave, Robert also from Tanzania, everybody that joined us on this session as well. Thank you very much, and remember to join us again next week. And then just to remind you about the French presentation tomorrow for people that are French, and you can promote that as well. So we were looking forward to see you all next week when we're going to talk about IPC monitoring and evaluation in our facilities and how we can do that. So thank you again very much for all your time and attention. And we will upload all these presentations at the end of this series on the ICANN website. If you do need anything before the time, please connect with us directly and we will get to see how we can assist you. We also know that Africa CDC also has on their website all the guidelines and new publications. So if you're looking for anything, you can go to the Africa CDC website or to WHO or Africa or just CDC website, and you will be able to get presentations or even guidelines and how to do on any of these websites. So thank you very much, and thank you, Lizzie, for taking the questions and answers for us, and thank you for your time. Have a good afternoon.
Thank you so much, Anna.
Recording stopped.
Thank you. Goodbye.
Thank you, Anna. Thank you, the rest of the panelists. Goodbye.
Thank you, Jacob. Goodbye.